Here's what to do if this happens when you are near. Step 1. Check for danger. Step 2. Check for response. Tap shoulders firmly and say, "Hello, hello, are you okay?" Step 3. If there's no response, shout for help. Shout, "Call ambulance 995" and "Get an AED." Step 4. Open airway. Head tilt chin lift method. One hand on forehead to tilt the head. 2 fingers of the other hand on side nearer to you to lift up chin. Step 5. Check for breathing. Look to see if chest rises. Listen to breathing sound and feel breaths on cheek. If only gasping or not breathing, start chest compressions. Step 6. Chest compressions. Locate the lowermost rib nearer to you and slide middle finger along the rib to the notch at the lowest end of the breastbone. Place index finger besides the middle finger and the heel of the other hand next to the index finger. Lock your elbows and with arms straightened, start 30 chest compressions at the rate of 100 per minute. 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10 and 1 and 2 and 3 and 4 and 15. 1 and 2 and 3 and 4 and 20. 1 and 2 and 3 and 4 and 25. 1 and 2 and 3 and 4 and 30. Allow chest to return to normal position after each compression. Perform 2 ventilations after every 30 chest compressions. Maintain the head tilt chin lift position and use your thumb and index finger to pinch the nostrils closed. Take a quick breath and seal your mouth over the casualty's mouth and deliver 2 quick short breaths of 1 second each, taking in a breath in between. Release the nose after each breath. Then continue CPR. If an AED is brought to the casualty, continue CPR without interruption. Listen and follow the AED instructions. The AED may prompt you to stop CPR temporarily. Continue CPR until the paramedics take over.